So you have a child who had one surgery, and in the past, till then, so what do we have, 2012, 30 years ago, children did not receive, newborns did not receive any analgesia, any pain management, or any anesthesia for some surgeries. And there was, in the Washington Post in 1983, was in the weekend supplement, was a mother talked about this, that she had gotten her child's record, and then she was just flabbergasted that the child had a surgery and had no anesthesia. But at that time, the anesthetics were thought to, it wasn't just cruelty, that was one, the anesthetics were thought to be too powerful. You would just kill the child, that little premature infant. But then it was also thought that, well, maybe they don't remember it. And I'm sure the child that had no anesthesia didn't remember anything. You know, if you talk to them years later, nowadays, because that child, you know, if a child survives, then you wouldn't remember it. But there is a memory, and we learned about this during the 1990s. So they do remember. And this was Anna Taddeo did this. Is a famous study in the late 1990s where she was looking at Emla cream, which is sort of one of these local anesthetic creams, and she was looking at it for vaccinations. Because it can be painful if you put some cream on, let it sit, would that work? And she noted then that some patients, little kids, at their shots, 1 month, 2 months, 4 months, they cried, but some cried a lot more. And she noticed that these were mostly boys. And that would have been interesting because we know from the adult literature it's the women who express more pain. So she became very interested because, wow, how would that be if before puberty it would be the boys, or maybe something changed. But as she looked further, they noticed these were boys who had circumcisions. And circumcisions were done at the time, and even nowadays still, without any analgesia. And they had an exaggerated pain response a month or 2 months later. So your central nervous system, you have modulation. It did remember. So there was that. And there are other studies that I don't have the time to go into. We know more now. We know that children who stay in ICUs or neonatal ICUs tend to have higher heart rates. They have higher norepinephrine. They have higher cortisol levels. There's a constant stress. So because they have many interventions. So we know that there is a change. So while the traditional view was that chronic pain is only a problem in adult children, or in adults, we have since learned that that's not true. So there's an increased awareness that chronic pain in children is common, it affects the entire family, it does use healthcare resources, and it does need to be studied. And you can see that it has been addressed more. There's Lonnie Zeltzer's book, Elliot Crane's book, and there's some books for general practitioners, and some of the arthritis patient groups have built little logos for children as well.
Excuse me, I'm sorry to interrupt you. When we're talking about chronic pain in kids, are we also thinking about kids who have to take multiple injections, and kids with juvenile onset diabetes?
Haven't looked at that.
Okay.
And I don't think, I'm not aware of any study there.
Okay.
So.
I saw their little bellies and I
yes,
thought of that.
Yeah. So the scope of this problem, epidemiology in these children. So when you go to a school that has been done in multiple countries, large population studies, so all school children in 9th grade, for instance, in a city are questioned, and you can see that 30 to 40% of the children will complain about recurrent pain. That is, at least once a week they have experienced pain. You will find this more often in females, more commonly in adolescents. Some nicotine, caffeine, and alcohol play a role. Parental and teacher support are protective factors. these are large epidemiological studies. That is not necessarily what you will see in an acute pain clinic. We'll sort of pare this down. So these are kids, that's a pretty high number then, once a week. So this was a Canadian community health survey, one of these, and it's a bigger group, 12 to 44-year-olds. There were 1.5 million with chronic pain, and when you look at the 12 to 17-year-old, were at least in Canada 100,000 adolescents with chronic pain. There were more boys than girls, and pain interfering with activities, 13,000 and 46,000 girls. So then when you come from this big school population, they have pain at least once a week. This is the kid with migraines or some back pain. Now this becomes a smaller number, pain interfering with activities. It is common, and it does affect daily activities, can affect employment as they get older. In the United States, it is thought, this is Lonnie Zeltzer study, that about 20% of children, of U.S. children, will have chronic recurrent pain. And it's associated with decreased social functioning, school absenteeism, and decreased quality of life. And that has been shown as well. What kind of chronic pain would you see in a child? There are headaches, abdominal pain, back pain, and then limb pain. In an acute care inpatient population, it's of course more cancer-related pain. That's more common. In a rehab hospital setting, I also work at Kennedy Krieger, we would see more this population. All right, so what are the common conditions that can lead to chronic pain in children? Why would they have pain? Is it surgeries, is it trauma or injuries? Is it congenital conditions, medical illness, or the mental health problems that we have discussed earlier? And all of them play a role in children. So this was a study looking at acute to chronic pain, and these are just the very first studies. They're just coming out. So this is not very far, hasn't very far evolved yet, this field. It's 2011, it's a cross-sectional study looking in children who had surgery and then they were followed, and on average 4.5 months, and 13% of these children who had surgery continued to have pain on average 4.5 months later. Many of those had orthopedic surgeries. Orthopedic surgery that can be spine surgeries, leg surgeries. The majority of the pain started immediately after surgery. It was in the location, was intermittent, but 50% had pain most days of the week, and
50% of the 13?
50% of the 13, and 30% of the 13 had pain that interfered with sleep and extracurricular activities. So when I see a child in pain clinic, this is sort of where we get. I'm not seeing the child that's complaining about pain once a week or has a headache and is asked on a 9th grade survey. But this is probably the child that I will see where there's more and more impairment.